Hello, my name's Kevin Harrington. I'm a professor in biological cancer therapies at the Institute of Cancer Research and at the Royal Marsden Hospital. For the last 10 years or more, I have also been a trustee of the Oracle Cancer Trust. So in the next 2 or 3 minutes, what I'd like to do is just to share with you the key themes of research that we are running through the Oracle Cancer Trust. The first of these areas involves something that we call imaging. That involves using specialist X-ray and magnetic scanning techniques in order to see tumours inside patients. As the great American oncologist Mal Pankos said, the odds of hitting a target go up significantly when you actually aim at it. The second area that I'd like to discuss with you is the use of radiation technology. Now, in the last decade, we at the Marsden Hospital have been pioneering a completely novel way of delivering radiotherapy in the form of so-called intensity modulated radiotherapy. This is a way whereby we can target the radiation doses specifically to where the cancer is and try to avoid normal tissues. In the last 5 years, we have published a series of landmark papers that have demonstrated both the safety and the effectiveness of this new way of delivering radiotherapy. And in doing so, we have changed practice both in the United Kingdom and around the world. The third area of research I'd like to discuss with you is the use of new drug treatments to combine with radiation. Now, for the last 20 years, we've been using standard chemotherapy drugs and combining them with radiotherapy, knowing that as a result, we will cure more patients of cancer. The trouble with this approach is that those drugs will cause almost as much damage in the normal tissues that surround the tumour as they will within the tumour itself. But in the last 10 years, we've begun to understand some of the specific genetic abnormalities that cancer cells contain. In effect, what we're able to do is make smart bombs that will hit the cancer cells but not hit the normal tissues. The fourth area I want to discuss with you is a completely new approach to treating cancer. We've known for at least the last 7 decades that certain viruses are able to cause cancer. But in the last 10 years or so, we've begun to understand that we can use other viruses as direct anti-cancer treatments. The final area I'll discuss with you deals with the oldest and best established treatment for cancer, and that is surgery. Again, work that has been funded by Oracle Cancer Trust has been looking at using surgery and preserving normal functions as part of the surgical approach. We have again published a number of important studies that have shown how we can continue to treat patients effectively but cause fewer long-term side effects. I hope that in this very short snapshot, I've been able to give you a flavour of some of the important and groundbreaking research that we've been doing. This work that has been funded by Oracle Cancer Trust is only possible through the generous donations of our supporters. I hope that I can count on your continued support in the future.